Welcome to Nursing School Explained, and this video on central line infections. That can be a very serious complication of a critically ill patient because those are the ones that typically have those central lines. So it basically means that that central line access has become infected, and because it is sitting in the patient's bloodstream already, there's a high potential that the patient may already be septic or become septic in the process. So very, very serious. This is sometimes referred to as CLABSI, which is central line associated bloodstream infection. And many years ago, this was a huge problem in the critical care setting. So it's now a core measure to where hospitals have developed policies and procedures to avoid this infection because it can be so detrimental to the patient's health and hospital stay. Signs and symptoms include all of those of infection or sepsis. So anything ranging from fever, chills to a painful red IV insertion site, drainage that comes from there, altered mental status because now the patient is dealing with this infection, all the way to sepsis, hypotension, and tachycardia. So very important to measure and monitor the patient for these signs and symptoms. As for nursing care, the most important thing, as with all of nursing care, is hand hygiene. When we access this catheter, but also handle these critically ill ICU patients in general. So number one, hygiene. Maximum barrier precautions for even a simple dressing change. So usually the policies and procedures include wearing a hair mask, a hairnet, a face mask, sterile gloves, so that we reduce the chance of infection to the patient's central line. Many times we also tell the patient to turn their head away if they're able, or put a mask on them as well, so that they're not breathing on that side that's many times located in their upper chest and their subclavian vein. We want to use chlorhexidine, which is a very, very effective antibacterial agent, but we need to let it air dry. So we can't be fanning germs on there. We can't be blowing it. That is an absolute no-no. And we cannot start to change the dressing or access the site before it has completely dried on the patient's skin. Of course, we want to assess the site frequently and flush it per whatever policies and procedures that your facility has. And the assessment, we assess for RETA, redness, erythema, edema, drainage, and approximation. We also want to assess the line for other complications such as infiltration and occlusion, and ensure that it's patent and flush the line as per policy and procedure guidelines. Now the treatment, when we know that this central line has been infected or the patient shows signs and symptoms of infection and we can't find any other source, then the line gets discontinued. We need to, of course, make sure that the patient has some other IV access at the time. The tip many times gets sent off to the lab for culture and sensitivity testing, so that we now know which organism is causing this infection. And then once the culture and sensitivity comes back, we will treat the patient according to that result. And in the meantime, they'll be put on 1 or 2 broad spectrum antibiotics. And of course, we have to monitor this patient closely because number one, they're already critically ill. Number two, they have now an infection and have all these symptoms. They might already be septic or be on their way or a high risk for being septic. So we need to measure them or monitor them very, very closely. Thanks for watching this video. Please give me a thumbs up and subscribe if you enjoyed it. Check out the other videos I have about the other central line complications as well. See you soon. Thanks for watching.